think one statistic that really stands out to me is our average age in this facility is around 63 years old. And I think in the typical long-term care facility in the United States, it's around 86, 87. Don't quote me on that. But anyways, it's a whole generation older than our current residential population. That reflects the fact that people coming into this facility generally have an aggressive form or an atypical form of multiple sclerosis. Most people with MS are diagnosed between the ages of 20 and 40 initially. So if they do have a pretty aggressive progression, they're often requiring 24-hour care before the age of 60. So that is much younger than most people who are attempting to look for long-term care. So as a result, we have a population that has a community-based experience with more current technology. So they're used to laptop computers, they're used to tablets, they're used to smartphones from their experience in the community. And we're trying to continue that experience as much as possible as they move into a 24-hour care setting. We do also have an outpatient program, and we do some education and consulting work with assisted livings and other facilities that have people who are still living relatively independently, but maybe in the future will experience a progression of their MS or some other disorder. We try to let them know that we will attempt as much as possible to maintain their existing lines of communication with family, with caregivers. And of course, now in 2023, most people have at least some familiarity with telehealth, whether it's with a neurologist, PCP, some other specialist. Again, if somebody's in their early 60s, they may have children that are in their 20s or 30s, maybe some very young grandchildren. So for most of them, using mobile technology is second nature. So being able to use an interface that allows for video communication, such as Zoom, FaceTime, Google Teams, Microsoft Teams, et cetera, is very natural for both the individual with advanced MS as well as their loved ones. And I think we're also seeing, especially both in terms of just the age of the individuals, as well as the fact that they've been living with a chronic disease for a number of years, we're seeing a very high degree of health literacy of people coming into our facility. So, we don't have to do any really onboarding education about what is MS or how do you treat MS, because really anybody coming in here could probably provide that in-service to us as staff about, I've been through these 25 treatments and seen these 20 specialists, et cetera. So because people generally are maybe connected with other allied health professions, maybe a dietitian, maybe an acupuncturist, maybe somebody else who's providing mental health services to them individually, we want to be able to optimize their ability to continue doing their own research, doing their own interaction with those allied health professionals, and being able to engage as much as possible, if there is any opportunity for them to be involved in research, again, with any of the teaching hospitals here in Boston or anywhere around the world, really, that's doing remote-based research. We want to make sure that they're able to engage with that population. And so therefore, using fairly mainstream technology like smartphones and tablets has really been able to give us the ability to maintain those connections that people already have, their network, as they're coming into our facility for long-term care. But it also makes it easier for us to demonstrate for all of the caregivers that are here. This is very similar to the phone that you personally might have. So this is how you charge it. There's just some basic troubleshooting tips. This is how you would position it to make sure the person can use the camera appropriately, et cetera. So again, without it being highly specialized technology, we can train a larger number of staff and family and other caregivers to be able to implement the devices with this population.